All right, let's talk about something that's, well, a bit sensitive, but it's also incredibly important for so many men. We're diving into incontinence after prostate treatment. The good news? There are absolutely effective ways to regain control and get your quality of life back.
Okay, so the big question is, what can you actually do about it? What are the real options on the table? Before we can answer that, we've got to understand exactly what's happening and why this is a common issue after prostate treatments.
So, what we're talking about here is what doctors call stress urinary incontinence, or SUI for short. You know, that leakage that happens when you cough or lift something heavy or even just laugh too hard. And the biggest takeaway I want you to have is this. It's common, yeah, but it's absolutely not something you just have to put up with.
So, here's how we're going to break it all down. First, we'll talk about the real-world impact of this, then how doctors figure out exactly what's going on. We'll look at the first steps that don't involve surgery, then dive into the 3 main surgical options, and finally, we'll talk about how you can choose the right path for you.
Okay, before we jump into all the solutions, we really need to take a moment and just acknowledge that this isn't just a physical problem, right? The impact it can have on your daily life is huge.
I mean, the daily stress of it can just be a lot. It can affect your confidence, your relationships, everything. And that's why the real goal here isn't just about being physically dry. It's about getting back to what they call social continence, which is just a way of saying you can go out and live your life fully without hesitation or worry.
All right, so how do we get from point A, experiencing this problem, to point B, finding the right solution? Well, it all kicks off with a really clear diagnosis. This is step 1, and it's absolutely crucial.
Now, I know this might look a little complicated, but think of it like a roadmap for your doctor. Over on the left, that's you and your symptoms. In the middle, that's all the tests and evaluations. And on the right, that's the destination, a specific treatment plan that's tailored just for you. It's a really structured, logical process.
And yeah, this process is pretty thorough, and for good reason. Even simple stuff like how many pads you use a day gives your doctor a ton of information about how severe things are. They'll even look at things you might not expect, like your hand dexterity, and trust me, that'll make sense in a few minutes when we talk about some of the devices.
So, I think it's really important to say this up front. Surgery is not always the first stop. For a lot of guys, the journey to getting control back starts with some more conservative, non-surgical approaches.
The absolute cornerstone of non-surgical treatment is strengthening those pelvic floor muscles. You've probably heard of them as Kegels. Seriously, building up these muscles helps your body's own system work better, and that can make a massive difference, especially in that first year. And for men who can't or don't want to go the surgical route, there are also things like external clamps that can provide a temporary but effective way to manage things.
But what happens when those first steps aren't quite enough, and this is still having a big impact on your life? Well, that's when surgery can offer some really effective, long-term solutions. So let's break down the 3 main options. Okay, so here they are. The 3 big players in surgical treatment all laid out. And you can see right away there's a huge difference we need to talk about. Some of these give what's called passive support. They just work in the background. But one of them gives you active control, where you're the one in charge. And that difference is key.
Yeah, let's really zero in on that difference because it's everything. Think of the passive support systems, the sling and the balloons, like a gentle hammock that's always there, giving a little lift. It's set it and forget it. Now the active system, the artificial sphincter, that's more like an on-off switch that you control. You're literally in the driver's seat.
Okay, so first up in the passive category is the male sling. It's basically a small piece of mesh that acts just like that supportive hammock we were talking about. It just lifts and repositions the urethra, helping your body's own muscles do their job better. It's a really simple, really elegant idea.
And for the right guy, the results are really solid. We're talking about studies showing that around 83% of patients are either cured or much better 5 years later. But here's the key thing. It's all about picking the right patient. This works best from mild to moderate leakage, and this is a big one. It's generally not the choice for men who've had radiation therapy. The tissue just might not be healthy enough for it to work right. All right, now the newest kid on the block in this passive support category is the adjustable balloon device. You can see it here. 2 little balloons are placed on either side of the bladder neck, and what's really cool about these is that your doctor can actually adjust them later, right in the office, to fine-tune the amount of support and get it just perfect.
So, how well do they work? Well, the numbers show about 60% of men get completely dry, and another 22% see a big improvement. I mean, those are great results. But, and there's always a but, right? There's a trade-off. Studies show a pretty high revision rate. We're talking more than 1 in 5 guys might need another procedure down the road. So that's something you definitely have to weigh.
Okay, so now we get to the third and final option, and this is the one that's been around the longest, the artificial urinary sphincter, or AUS. This picture here is actually from a surgery, and it shows the most important part, this cuff that wraps completely around the urethra. That means it can create a perfect 360-degree seal.
And look, for decades, this thing has been the undisputed gold standard. And there's a really good reason for that. It's the most effective, most durable solution. And this is critical, it's the only one that's officially recommended by the guidelines for men with severe incontinence or for any man who's had radiation in the past.
And the results? Honestly, they're just staggering. When you look at long-term studies, you see patient satisfaction rates as high as 92%. Just let that number sink in. 92%. That tells you just about everything you need to know about how life-changing this can be.
And to put that 92% in even clearer terms, a landmark study found that that exact same percentage of patients said they would recommend the surgery to a friend. I mean, can you get a stronger endorsement than that? It just speaks volumes about the impact it has.
Okay, so we've covered a lot of ground here. We've got slings, balloons, and the AUS. So how in the world do you and your doctor figure out which way to go? Well, it really becomes a shared decision, and it usually boils down to just a couple of key things. When you strip it all away, the decision really hinges on 2 things. How severe is the leakage, and have you had radiation therapy before? If it's a mild to moderate case and there's no radiation history, those passive devices, the slings and balloons, are fantastic options. But if we're talking severe incontinence, or if there's any history of radiation, the guidelines are crystal clear. The AUS is the gold standard, period.
At the end of the day, this is all about one thing: getting your life back. Achieving that social continence we talked about, so you can do what you want to do, when you want to do it. We really hope this explainer has given you the knowledge you need to go have a confident, informed chat with your doctor and take that next step on your journey to regaining control.